Welcome to the Health and Wellness Talk Show with Dr. Daniela Steyn. Dr. Steyn is a medical doctor, wellness expert, and assistant clinical professor in family medicine. Her mission is to inspire and enable you to live your best possible life with optimal health. Prevent disease through healthy lifestyle choices and use food as medicine to support longevity, energy, mental clarity, happiness, and well-being. Join us today as she interviews guests, empowering you to live your best life with optimal health. Connect with Dr. Steyn at www.danielasteyn.com. Subscribe to our YouTube channel today.
Good day and welcome. I am Dr. Daniela Steyn. I'm a medical doctor and a wellness expert. Welcome to my video talk show and welcome to Jessica Pozo.
Thank you, Daniela, for having me.
I'm so excited to have Jessica with us today. Jessica is a registered nurse. She studied at the University of Ryerson. Then, after working for a very long time, she became a health coach through the Functional Medicine Institute. And Jessica specializes in burnout for nurses. So as a nurse, she has experienced burnout in her own life. She overcame the burnout, and now she's so excited to help other nurses and other people overcome burnout. I work at a very, very big hospital where I face burnout myself. Many of my physician colleagues have faced burnout, and many of our nursing staff have faced burnout. So for me, it's personally such a big mission that I have to help people, to equip people that go through burnout to understand what it is and what they can do to get better, to live their own life to the fullest. I've had 2 podcasts where I interviewed other physicians regarding burnout. So I'm now so excited to have a nurse here that can give us a nursing perspective. And not just any nurse. Jessica has a health coaching business. She started the Toronto Health Coach. Welcome, Jessica.
Thank you so much for that introduction, Danielle. I'm really excited to be here with you today.
So, Jessica, let's start it from the beginning. Tell us your story.
Yeah, absolutely. So regarding my health journey.
Yes,
yeah?
Let's start your own health journey, yes.
Yeah, so I'll try to keep it brief. It is quite a journey that I've been through, and it all started in my mid-20s. So, during a period of life where you don't really think that, you're going to start losing your energy.
No.
Yeah. And so I'm in my mid-20s. I'm working 2 nursing jobs. I'm doing some courses on the side and full social life, things that to me seemed like normal. And I started to struggle with my energy, and I started to feel tired in the afternoons. I started to fall asleep, during evening engagements with friends. And that, being the high achiever that I was, that wasn't sitting well with me. I was like, why is this happening to me? I'm only in my 20s. I shouldn't be falling asleep at 9 p.m. when I'm trying to spend time with family and friends. So I started, and just being, in the culture of being a nurse and just, I think, the corporate culture and just a North American culture in general, it's go, go, go. It's high pressure and drink some coffee and,
Yes.
Keep going and
Coffee and sugar and go.
coffee and sugar, keep going. It's fine. It's normal. It's normal. It's normal to get tired in the afternoons. You're waking up really early in the morning.
You're working shifts, you're a nurse, you're working long hours.
Exactly. So, when I'm talking to people about feeling tired in the afternoon, it's like, yeah,
Get a coffee.
have some coffee, have another coffee, or try cold brew, or so yeah, I started with that. I started with coffee, and it was for me, like when I was going through school, I never drank coffee. I wasn't a coffee drinker, so I started drinking coffee. That that marginally helped, I guess, but it's still. I got to the point where I would have coffee before an evening outing and still be tired and still be falling asleep. And I would even say to people, coffee doesn't affect me. I drink I drink coffee, I go to sleep right after. It's, later I learned that wasn't exactly the best thing to do. But anyhow, I started to look for answers. I didn't care what people were saying. I'm like, this to me is not normal, and I need to get things done in the evening, and I want to spend time with my family and be there and be present with them. And I started to go to the doctor and find out what was happening. So I went to my family doctor, and they ran the blood work, and the blood work was, it was all normal. And he, there was kind of like borderline iron happening. So he decided,
low iron.
Yeah, borderline, lower. I didn't have anemia, but it was,
if
he's
you're
like,
looking for something, the only thing your doctor could find.
yes.
As a family physician, I've encountered that before I learned more about functional medicine so often, that people will come and say they're tired. And then I'll run just our limited panel that we generally do, not functional medicine testing, but that limited, nothing wrong. And then
Exactly.
it's hard. If someone says, but I know there's something wrong, and your doctor tells you, oh no, but your blood work is normal.
Yeah.
That's so frustrating.
Yeah. And that's that. And he's like, it's normal, but maybe it's borderline low. And I think a common thing that I hear with my patients too is like, menstruating women or it's normal to have sort of lower iron levels. And I later learned that, you can replenish your iron and that sort of thing. But in this moment, that was what he could check. So he checked for that, and we started the iron, and that, kind of helped a little bit, but it wasn't enough. Like I was still falling asleep. I was still not feeling well. So
to explain to our audience a bit, when we are anemic, so when you lose blood for some reason, or you have your menstrual period every month, you lose blood, then your body has to make more red blood cells. You need red blood cells to carry oxygen to your brain, to be awake, to be able to run that marathon, to go as a nurse, to work long shifts. You need a good hemoglobin. That's your red blood cells. But then for your body to make more red blood cells, you need iron. And that's usually why we look at iron first, because you continuously make new red blood cells. A red blood cell lives 120 days, then your spleen breaks it up again, makes new ones. And then for a woman, has to make more continuously. And that's why we need a lot of iron. So that is very common in women to have an iron deficiency. And if your iron is low and your body can't make red blood cells, then your hemoglobin will be lower. And when your hemoglobin is lower, you do become very fatigued. But people don't notice it because it's so slow and gradual that what I typically see is people just start eating more for energy. So they gain weight. So that is usually when people come to me with weight loss and they just say, oh, I'm overweight, I can't do anything. One of the first things I would check is iron. Okay, so tell me more.
Yeah.
So your iron was a bit low. So,
Yeah,
and what did
so-
you do? You took an iron supplement.
Exactly.
Okay.
Yeah. So we had some Ferromax going, and that came along with some unpleasant side effects, as are common with Ferromax, and
can
being
have
constipated.
Constipated, or
yeah.
some people with cool severe diarrhea, stomach upset.
Yeah. So, it wasn't a great solution for me. So I persisted of, like, what else can we
Good.
do? And so the next recommendation was to do a sleep study. And so I was feeling like there's nothing wrong with my sleep. I lay down, I fall asleep easily. I sleep for 8 hours. I wake up in the morning. I seem to be okay still. Like I'd wake up really early. I'd go to boot camp in the morning. Then I'd go to my nursing shift. And the morning energy seemed to be okay, but it was, in the afternoon when I started to feel really down. So anyhow, I'm like, okay, we'll do the sleep study. I don't think there's anything wrong with my sleep, but let's go. So I did the sleep study, and that was normal as well. So, in the sleep studies, they really check for sleep apnea, I think is like what they're really trying to look for.
Will you tell our listeners what is sleep apnea?
Yeah, sleep apnea is a condition where when you're sleeping, you're being obstructed when you sleep. So you stop breathing when you sleep, and then your oxygen levels dip, and then your body wakes you up to try to get you to breathe again and to restore those oxygen levels.
And people often don't realize that. So the whole night they go through these periods of low oxygen, waking up, but you don't realize it. So then you're so exhausted the next day, and you don't know why you're exhausted. So same thing when people have sleep apnea, that causes weight gain because you don't have energy to work out. You have to eat more for energy. So that is a big one.
Exactly.
But it wasn't your problem.
That wasn't my problem. No, and I didn't think it was my problem anyhow, but
But now we know. You're
I
good.
went and
Yes.
I wanted to do the check. So that's fine. And then during that time I was also I was working in oral surgery, and then I was working in sort of a specialist office, and there is a TMJ specialist. So he helps people with night guards for sleep apnea. So he's also looking at sleep studies. And so, I later showed him my sleep study, and he said, well, you weren't having periods of apnea, but you're having periods of hypopnea. And so that was kind of an indication, from his standpoint, that I'm not breathing optimally. Like, I'm breathing fine. I'm not.
You didn't stop breathing,
yes.
but everything is on a spectrum, right?
Exactly.
So you just not okay.
Yes.
So your oxygen does drop at
yes.
times.
So you can see on the sleep study report that there's hypopneas, right? And so he showed me that I was having periods of hypopneas. But with the sleep doctor, and like I totally understand that wouldn't be relevant to him because he's looking for apnea, right? And so I was so lucky that I was just happened to be working with somebody who kind of takes a different lens to the sleep study. And so now I wear these funny things like nose cones in my nose. So
I saw that on Insta.
Yeah.
I was wondering what that's about. Okay,
Yes.
so it keeps your nose open to breathe.
Yes. So he did like a quick assessment, and to see, I would obviously tell anyone to go to ear, nose, throat doctor to see like if you have a deviated septum and get assessed like that. But, he did a quick assessment of me and said, it seems like you have a deviated septum. And so try these nose cones.
Okay.
So since then, and I was actually tracking my sleep at the time, so I could see that it helped to improve my sleep.
And how did you track your sleep?
So I have a Fitbit, and with my Fitbit, they give you like a sleep score on your Fitbit, and so you can see it sort of reflects the quality of your sleep, I guess. And obviously having a sleep study would be more accurate in that, but it's a nice thing to have that many people have access
available.
to.
Yeah.
Exactly. So checking on your sleep score. So I did that. So I started wearing the nose cones, and I could see an improvement in my sleep, and that did help as well. But there was more. There was more to the story, of course. So I was also working in an IV nutrient therapy clinic at the time. And so, being from the medical community and not being exposed to naturopathic medicine and not being sure and like being a little bit hesitant with naturopathic medicine at that time, even though I was working with a naturopathic doctor, I was like, okay, I'm being assessed through the medical community. And so eventually I got to know, like, and trust her, and I'm like, okay, let's see. So I went to see the naturopathic doctor that I was working with as a client. And she found that, so there was a few different things. So one of the things was that my gut health was impaired. So
that's a big one.
Yes. Yeah. And so because I was working in IV nutrient clinic, that was great for me because I was able to get IV nutrients.
Perfect.
And so what that means is that I can get the nutrients right into my bloodstream, and it doesn't have to go through, your gut.
So if your gut health is impaired, it means your gut can't absorb nutrients from your food as well. So you might think you're eating this healthy, organic, perfect diet, but you're not absorbing the nutrients. Well, same as your iron supplement. You're not absorbing it.
Exactly. Yeah. So with the iron, it's like I wasn't vegan. And even if you are vegan, you can still get iron. But the point is, I was eating iron in my diet. So why was I having borderline low iron, right? So, and it was because I wasn't absorbing it right. And there was, there's different aspects to your gut health that you can address. But the point is, I wasn't absorbing those nutrients that I needed. And so luckily for me, I was working in an IV nutrient therapy clinic, and I was able to receive IV nutrients. And the other thing was, we did a micronutrient test, and I did have a B12 deficiency.
Oh, that's
so
a big one.
I was able to get that in the IV.
Perfect.
Which that was significant. That was
And did you notice a change in your energy levels?
Yes.
See, so a lot of patients ask me for that. And I didn't understand it when I took a family practice over in Alberta 12 years ago. A lot of my patients from the previous physician used to come for vitamin B12 shots every month. So they would ask me for their B12 shot, and I wouldn't understand, why do you need it? Why don't you just take a vitamin B pill? And I honestly didn't get, why do you need a shot if you can just take a pill? And then in South Africa, it's very common to have IV clinics. So a lot of my patients here, because they don't have as easy access in Canada, they would go to the States, get their IV nutrients. And I honestly, before I delved into functional medicine as a family physician, I didn't understand. If If you eat your food, if you take your supplements, why do we need anything else? But you explain it very well now. It's just because your gut couldn't absorb it at the time. Even though you're young, even though you're healthy, your gut couldn't absorb it.
Exactly. So that was once I started doing the, weekly IV treatments, and then I stopped the IV treatments and moved to the IM injections of B12. And then I continued to supplement orally after that. So it gave my body a chance to have those nutrients available to help me to heal. And so that was really significant in terms of my gut health. And then there's a little bit more to the story.
So tell us.
So the other part was something we call adrenal fatigue. So my naturopathic doctor diagnosed me with adrenal fatigue, and it's kind of like a controversial topic, I think, in medicine, because we kind of take, it's either like hyperactive or like hypo and then or not working at all. But adrenal fatigue is kind of looking at like the middle and seeing that range, that spectrum.
Yes.
And so adrenal fatigue is, you have these adrenal glands on top of your kidneys, and they help to modulate those hormones, particularly cortisol. And so when you need cortisol, it's excreting the cortisol. And if you're going through a lot of stress and it's a constant thing, those adrenal glands can get fatigued. And so that was what was happening with me, was that it was interesting though, because my doctor or my naturopath would ask me if I was stressed, if I felt really stressed. And sure, I was working the 2 jobs, I was doing the courses on the side. Like I was doing a lot of things, but mentally I didn't feel stress. Emotionally, I didn't feel stress. And I've always had really great coping mechanisms. So I never, when I was younger, like when I was in my mid-20s, I didn't feel overwhelmed often. Like I had a lot of things, but I was really ambitious, really high achieving, and so it was all part of the process. And I didn't perceive any stress. But what she explained to me was that everything, all the demands I was putting on my body was stressful. So my lifestyle was stressful, even though I didn't perceive to be stressed.
I'm reading a fascinating book about that now by Gabor Mate, When the Body Says No, where he breaks that down. It was eye-opening to me because in my own life, I've gone through burnout, but I signed up for these things, but I love it. I love running marathons. I love having kids. I love going out all night. I love, being chair for a board of directors. I love running big organizations. But then your body says no at a certain point, because we're not in touch with our body. And that's what you learned to start to listen to your body. It's not just you. Yeah. It's you have to listen to your body.
Yeah. Yeah. So my body was like...
Was saying no. You were saying yes, 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 but your body was saying no.
I was like, but I want to do all these things. Yes. And my body was like, no. You're going to sleep now. And so that was happening. I'm trying to have a conversation and I'm just falling asleep because my body was like, that's it. You need to rest. So
do you think shift work exacerbated it? Were you doing shift work at the time?
At that time, I wasn't, but I was working 2 jobs. So I was working like from 7 to 4 and then going to work after that and then working until like 9. So I was working long hours. I wasn't working, luckily, I kind of set myself up to not work shifts once I graduated. So,
but still you were doing 2 jobs.
I was doing 2 jobs and I was studying and still trying to, have a social life. Yes. So like all the things. Yes. But yeah. The people that I work with, the nurses that I work with, that shift work definitely, exacerbates it.
Because it throws your biorhythm off quite a bit.
Exactly. Yeah.
Yeah, that's what I find as well.
Yeah. So that's
and then so you were healing yourself through looking at general medicine as a nurse, but then more looking at functional medicine and then also looking at holistic medicine. And then, so did you recover from burnout?
Yeah, I would say so. There's still obviously periods of time where you feel tired, and that's fine. But I know now the things that I need to do.
You can recognize it.
Yeah.
You don't wait to fall asleep in a conversation. You can recognize it before, and you can put things in place.
Yeah.
Because you're still go. You have a small business. You still work full-time as a nurse. You have the Toronto Coaching Academy, and then you also have a 1-year-old son, Kaysen.
Yes.
Yes.
He's been walking since he's been 9 months. So.
Oh, so much fun. So much joy.
Chasing him is a lot of work, but yeah. So I'm still, but now I have all the tools in place to help me optimize my biology, we can say, to to allow me to do all of those things.
Okay.
Whereas before I was like, go, 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 but I wasn't replenishing. I wasn't filling
just
up my
go
cup.
till you crash and go till you crash. Now okay. And then that prompted you to study at the Functional Coaching Academy. Tell us about that.
Yeah, well, that's an interesting story too. So while this was all happening, same time where I'm working in this IV nutrient therapy clinic. So I in Canada, health coaching is still something that I'm
new.
explaining.
Yes.
Nobody knows what I do.
Yes.
They're like, what is that? So
Tell us.
Yeah. So I found myself in Washington because I was getting some training, and I sat next to a nurse turned health coach. So I spent the weekend with her learning about health coaching. And so health coaching is really about the behavior change aspect. So when it comes to functional medicine, a lot of the recommendation is lifestyle based, and implementing those lifestyle changes is so challenging, right? And, in medicine, we don't have time to really coach our clients
But we also don't understand it.
Yeah.
Our guidelines for me as a physician, when I take a patient's blood pressure and the blood pressure is a little bit high, our guidelines are to do lifestyle changes. And if blood pressure is still high after 6 months, put a patient on medications.
Yeah.
Or if a patient is pre-diabetic, do lifestyle changes first. If a patient has a bit high cholesterol, lifestyle changes first. So I used to tell my patients all the time, go change your lifestyle and go.
Yeah.
And then I realized no one changed.
Yeah.
So I read up on it. I'll have pamphlets and I'll say, okay, these are the steps. You have to exercise. You have to eat healthy. Follow these steps. And then people will come back 6 months later. And most of our illnesses, acid reflux, everything can be with lifestyle. We can prevent cancer, stroke, heart attack. Most of the patients that I see in hospital can be prevented perfectly well. Cancer we can prevent with lifestyle changes, but I've never been successful in teaching people that. I can show them the studies. If you change, you're going to be healthy and live long. If you don't change, I'm going to see you in hospital in 30 years on renal dialysis. But I've never been able to do that. So it was a complete game changer to me when I did my training through the Institute of Functional Medicine, and I got introduced to a health coach. And I didn't even want to. It was part of the program. You had to sign up with a health coach.
Yes.
So I had this lovely health coach, Cecilia. She's absolutely amazing. She teaches there. And she would call and say, okay, when's your appointment? And I'm like, I don't have time for an appointment. And she's like, well, if you want to do this course, you have to make appointments with me. And it's been such a game changer in my own life that I'm now practicing it with all my patients at the wellness clinic. If they want to sign up with me, they have to sign up with my health coaches. So it's such a critical part of having that behavior change. It's things that I, as a physician and in my personal life, I couldn't do, but health coaches get training on how to help people to do it.
Exactly.
So what do you do as a health coach, and why did you choose that academy? Because there's different places where you can get training.
Yeah, thank you for asking me that. I think it's such an important thing to know because especially right now, so health coaching isn't a protected title. It's not a profession like, being a doctor or being a nurse, and you have a college that you're accountable to, and you people that are establishing standards for you and all that. So health coaching isn't there yet. It's not a profession. And so knowing where, if you're wanting to work with a health coach, knowing where they're trained is really important. And then some things that you can also sort of ask about is, where were they trained? And also, are they board certified? So in the US, they have the National Board of Health and Wellness Coaches. And that is sort of pushing the title towards a profession. So they're working it towards that. But right now, they're still sort of establishing guidelines. There's an exam that you have to take. So in the US, that's kind of like the gold standard. In Canada, there's a Health Coach Alliance. And so they're the ones that are sort of trying to move things forward for health coaches in Canada.
To help regulate it.
Exactly.
So that if you have to pick a health coach, you know which one to pick. It's one that's been certified by a certain council.
Yeah, exactly. So it's not yet a protected title like a profession. And so what that means is anyone can call themselves a health coach, right? And so when I was first trying to find out more about health coaching, because I met this nurse and then I was like really curious. I came back, I started researching all the schools, and there's so many schools for health coaching. And some of them are great and some of them are not so great. And so the reason I chose the Functional Medicine Coaching Academy is because it is partnered with IFM, which is the Institute of Functional Medicine, where functional medicine doctors are trained. And so that, to me, being a nurse, wanting to choose a school that seems, very legitimate, I went with the Functional Medicine Coaching Academy because of that connection to the Institute of Functional Medicine.
Which is valid. And that's also why the health coaches that work at my clinic, I only use health coaches at this stage that are trained through the functional medicine, because I know what training they got and I know we're on the same page.
Exactly.
So I don't minimize other academies at all. It's just something that I understand, and I know the training exactly. I know the curriculum, so it's something that I'm very comfortable with.
Exactly. And so the Health Coach Alliance in Canada is sort of looking at all of the schools and allowing certain schools to be eligible for their graduates to be registered through the Health Coach Alliance. So, if you're working with a health coach in Canada, if they are registered with the Health Coach Alliance, that's a sort of good indication. And then another thing, if you want to be like really protective, is finding a health coach that is also a professional. So if they are a health coach and a professional, they still have to be accountable to their college.
To your nursing college.
Exactly.
So you can't tell me things that's not congruent from the nursing college perspective.
Yeah. So even though I'm working in a health coach capacity, I still have to be accountable to my college. Yeah.
Yes. Okay.
So,
yes. Yeah. That's very helpful. Yes, I'm sure the listeners will. So if any of our listeners now listened and they think, oh, so maybe I do have burnout, maybe not. What are, in the clients that you work with, typical symptoms that you see that someone has burnout? Because that is something that's been hard for me. So first, it's been hard for me to say that, yes, I have burnout, because the first time I had it, I was so young. I was very new in a practice, and I've been working with doctors that are 30 years older than me, and they are working in Emerge, delivering babies at night, doing house calls. And I only realized, some do the house calls and some the babies and some in the OR. Initially, I just thought, oh, people do that, so I was doing everything, whereas everyone chose one. And I've really felt the need to prove myself as a young physician, saying that, so now I got burned out, but I was a couple of years in my career. And then these people were old. Well, they looked miserable. Maybe all of them were burned out, who knows. But it was hard for me to understand the word. What is exhaustion? What is depression? What is burnout? Can you tell us a bit more about that?
Yeah, I can absolutely relate to what you're saying. Because even for me to talk about experiencing burnout, it's still something that I like to use the terms exhaustion and low energy. Because what I later learned is that there are stages of burnout. So when we think about burnout, we think about, that complete mental, emotional, physical exhaustion where you can't get out of bed, you lack, like your motivation is gone, you're not productive, and that sort of thing. And, having to identify as like yourself as being burnt out kind of feels like a little bit of a failure in a way, I guess.
Yes, and that is what I've seen with physicians and nurses who I helped in my wellness clinic. So that is, they didn't like that title because they feel there is a flaw inside of them for not being able to cope with the same amount of work that a colleague can cope with. And that was new to me. And I really feel that it's more unique because my patients one of my patients is a mum, and she told me she has burnout as a mum. She doesn't work. She was more comfortable having this title through the pandemic, and being a mum is very hard. I'm not minimizing that.
Yeah.
But I feel she was more comfortable saying that I've burnout than physicians are. Physicians, there's really as if there's the stigma, and so I think we first have to identify that. And the World Health Organization has a very good definition for it, but no, it's not a flaw that you're not coping. It's really, and it's often systemic things, more than you yourself and your body that says no.
Exactly. And so learning that there's stages of burnout, that kind of makes me then feel more comfortable to say okay, I had burnout. I was in an earlier stage of burnout. And the reason that I use exhaustion and low energy in my messaging is because I want to catch people before they're, stuck in their bed and can't get out. I want to help them before they're getting there. I want them to recognize that feeling tired in the afternoon is not normal. It's common. Sure is common, the afternoon slump, but it's not normal. You don't have to, it doesn't have to be like that. You don't have to, just because you wake up early doesn't mean that you have to be tired at 9 p.m. You can recognize these things sooner. You can, as soon as you start to feel that your energy is dipping and, you're trying to maintain a healthy lifestyle and all these things, and you just can't find the energy to do the things that you want to do, that's already indication enough to start to to do something about it.
And you lose some of your joy. You don't get
You
joy
start to
from
lose
playing with
joy.
your kids anymore. I find that's a red flag
Yeah.
sign. If you just lose your joy, hobbies that you used to enjoy,
Yeah.
or avoiding friends who you used to love hanging out with,
Yeah.
and you just don't get that joy anymore.
Yeah, and for nurses, like we're always putting our patients before ourselves, and getting to a point where you don't want to go to work anymore. You don't want to help people anymore. It's like, what? Like, we got into the profession to help people, and especially, with the whole pandemic that happened and so many nurses leaving the profession, it's no wonder.
The pressure is very hard on nurses.
Yeah.
And then if you look, it's not only the nurse who suffers and her home and her kids, it is also our whole healthcare system. We have a lot of good data that I looked at how patient care deteriorates, where you have decreased patient care and medical errors happen easier when you work with burned out staff. So that's a big thing.
Exactly. And it makes sense, right? I mean, if they're not catching this early enough to start to do something about it, they get to the point where they can't go to work anymore. They have to look for a different career. And and it's sad because...
Which is devastating.
Yeah.
Because it's people who are passionate, who want to help. It's your life's mission. And that's where there's a big responsibility on big organizations, on the hospital, to really put in place their wellness programs to look after their own people, to prevent burnout. Yeah, so that's quite a big thing.
Yeah, that's definitely a big vision goal of mine, is to see, health coaching and functional medicine readily available in the healthcare system, because it really takes a different lens and really helps people to make those difficult changes towards their health.
For sure. So if there is any of our viewers today that has been listening and they're like, I think maybe I have burnout, what tips can you give our viewers and our listeners to what can they easily do in their own life if you don't have access to a health coach to prevent burnout or to turn burnout around?
Yeah. So first of all, I would always say, like, if you think that you're experiencing burnout, always seek professional help, whether it be with a functional medicine doctor, naturopathic doctor, your physician. Seek help. Don't try to do it alone.
For sure.
Because there are a lot of great programs that are available that can help, especially with the mental, emotional side of burnout. And so, I would start there. Talk to somebody, talk to a physician who can help you with that.
Sure.
And then, from a lifestyle perspective, definitely not discounting nutrition. Like, nutrition is so imperative. What we're eating, how it supports our gut, how it supports our detoxification systems, and then just our energy overall is so important. So, whole foods, minimally processed diet, some good quality proteins and fats, and colorful fruits and vegetables. And
that's a big one that we learned, is that it's incredible how food is designed in such a way that the way food, the phytonutrients and micronutrients in a certain vegetable, in broccoli, gets absorbed so much better in your gut than taking vitamin C supplement alone and magnesium alone. So the way foods is really that perfect combination of getting those nutrients, but to try to eat like 200 veggies over the course of the year, 200 different veggies, because if you just always eat broccoli and cauliflower, then you don't get all those nutrients. Exactly. And with nutrients the same, which I teach my patients, so that's what you were talking about, the colors of the rainbow. If you have this color chart and you eat red tomatoes and orange peppers and green leafy greens, if you really try to cover all the different colors, you help yourself to know that you're covering all the different foods.
Exactly.
Which is important for your gut health, but it's also important for your whole body. Gets made not out of thin air, but out of what you eat. So it really becomes part of your body, what you eat.
Yeah. And I think that's so important to mention, because probably a lot of our listeners can relate to going to the doctor and kind of, being told that nutrition doesn't really, like what you eat doesn't really matter. It's okay. Like, you can, so really driving that home. And like, when I learned about functional medicine and food as medicine, like, now it's kind of,
it's a game changer.
Yeah,
eh?
It really is.
Yes. And so for our viewers and listeners, if you're more interested in this topic, I have blogs on my website on everything that we're talking about, on leaky gut syndrome, on the whole gut-brain axis, on micronutrients, macronutrients, everything that we're going through. There's blogs. So read up on it and empower yourself. It will be such a big game changer for you. Just do it. Just help yourself to live your own optimal life.
Yes, exactly.
So what else can they do? They must
Yeah.
eat healthy. They must seek
Yes.
professional help. What else?
Yes, definitely focusing on gut health as well. So, you know,
Yeah.
that big part of my story was that I wasn't absorbing it right. And so, you know, looking at mindfulness around eating, you know, being present with your food, that's sort of the first step in our digestion that is often, you know, overlooked or not really talked about, is like cooking your food and looking at your food and smelling your food. That gets the whole process of digestion started. So mindfulness around food, how you're chewing your food, you know, the stomach acidity levels that are, you know, then to break down the food from after you've chewed it. Now it's, you know, traveled down. So your stomach acidity levels, and then your gut flora, you know, like having
gut flora
yeah.
for our non-medical viewers. So that would be the bacteria in your gut. Another blog on that on my website. So our gut is full of bacteria, loads and loads and loads of bacteria. You have so much bacteria in your gut, you won't even believe it. We call that the gut microbiome. It's like a whole biome of bacteria. And those bacteria helps you to absorb more food. But then 90% of your feel-good hormone, your serotonin, gets secreted in your gut. So if you're eating junk, then you're never going to be happy and healthy. But if you eat all those healthy foods, and as you say, unprocessed foods, not foods made in a factory, but foods that really come from a farm, like vegetables. And we say meat is okay, but we prefer not factory farming because that's not good.
Exactly.
So really pasture-raised, grass-fed types of meat that feeds your gut and that helps fight burnout.
Exactly.
So that's a big thing. So
Yeah.
look at your nutrition.
Yep. And, you know, like how regular your bowels are is important as well.
It's easy for us to talk about that. Nurses and doctors,
Yeah.
when we see our patient first thing in the morning is, so did you have a poop?
Exactly.
Yes. And that's important because all those toxins stay in your body. And especially with women, we find it so common that a lot of my female patients are constipated. If you're constipated, that toxins that's supposed to be secreted every day stays in your body. And we're so exposed to toxins every day. And I don't even enjoy talking about toxins because it's a bit scary.
It is scary. It's a little bit too much sometimes. But yeah.
So let's leave that for your next time we have you over.
Yeah.
But just to know that even if you are exposed, if you do have a lot of fiber in your diet and you do have a bowel movement every day, you get rid of all the toxins.
Exactly.
And then staying there, apart from just toxins, there's so much evidence that your risk of colon cancer, so much bigger if you don't have that regular bowel movement. Okay, so we have to seek help. We have to eat better. Gut health. Next one.
Yeah, so I did forget to mention hydration along with nutrition. So don't forget to be hydrated. A lot of us don't drink enough water. And it doesn't have to be water. It could be like, soda water or like herbal tea. But being hydrated and, its role in all the things, but especially in gut health and in detoxification. And, so how do you know that you have enough hydration is when you pee and it's pale, it's not supposed to be like deep yellow. So drinking enough for hydration. So that goes along with nutrition. But the next thing is movement. And the one thing that I want to say about movement is I was moving. I was going to boot camp every day, right? And I thought that was great movement for me. And it can be for some people. It's great for stress relief and that sort of thing. But when you're dealing with adrenal fatigue and burnout, sometimes really strenuous exercise can actually be counterproductive. So I like to talk about movement and how we move our body and just having regular movement, but the right types of movement when it comes to dealing with burnout.
That's right for you and not too hard on your body. Yeah, and
Exactly.
I've definitely seen that just being an endurance athlete myself. I love running and I don't get tired and I can go. But I've learned for my body, I should stay with shorter distances. I shouldn't. And maybe one day when I don't have little kids, when I don't work at night anymore, I'll do longer distances again. But yeah, that's so important to listen to your body. So what types of movement do you do?
Yeah, so any sort of movement, and it could be
like
random.
yoga, Pilates.
Yeah, there's all the regular things we think about, but oftentimes I find with my clients it's playing a sport or like hula hooping or like doing something like just incorporating more movement into your day. Parking further away from the building so you can get a walk in, or taking the stairs. Functional movements where things which are, just movements that we make in our regular day. Sometimes I'm hanging out with Kaysen and I'll just do some some body weight exercises sort of on the floor kind of thing. So it doesn't necessarily always have to be like a dedicated thing that you do each day, but just incorporating more movement into your day. So yeah, like yoga, Pilates, all the things, but also just figuring out how you can add in more movement to your already,
and to make it a
routine.
priority, to go for a walk after dinner rather than just watching
Yes.
TV.
Yeah.
Or especially with my kids, they love having PA days and we have snow days. But then we first have to go to the park, and they love having screen time. But yes, we just first have to go to the park. And they might be reluctant to go because they rather want screen time. But then once we're out the door, they're happy and they're running. And I make sure that we walk to the park, that we don't drive the car there, and then they can play for hours and get that movement in.
Exactly.
And we need it as well as adults.
Yeah. And I love how you mentioned going outside, because then that's another thing, the exposure to vitamin D and nature, getting out in nature.
Ecotherapy. That's a big thing. Yes, they've done studies here in Toronto and Hamilton where they look at a group of people who walk. The study at McMaster University, where I'm associate professor, they look specifically at blood pressure. Group of adults were just walking between houses, and the other group of people or on a treadmill, and the other group of people were walking between trees. And then the group that was walking in the forest had this much lower blood pressure, lower cholesterol, all their health parameters improved.
Yes.
And the study in Toronto was done with kids with ADHD. So the kids that got exercise in from running indoors in a gym versus kids that were allowed to run outside in the woods. And the kids that were able to run outside in the woods, they had better concentration, better focus, they scored better on tests, their ADHD symptoms were less significant in class. So that's quite significant if you know that just before school, if you go with your kid who does have ADHD, if you go with your kid for a run through the woods before school, your kid is going to have such a much better day.
Yeah.
Than just watching cartoons and go.
Yeah. Yeah. It's instant calm. Like whenever I go out, sometimes it's hard. I'm busy. I'm trying to work on my business, and I don't find the time to go outside. And then sometimes I'm just like, okay, I have to go. And as soon as I'm there, I'm like, oh, it's so relaxing. Yeah. It's so relaxing to look at the trees. So yeah. So movement. And then the last thing is sleep. So that was, I told a little bit about my story with sleep. And after I got trained in functional medicine, I learned that there were so many more things I could do in terms of sleep quality that I never even realized.
So it's not just the hours.
It's not just the hours.
But the quality.
Yeah. So, if you think you have sleep apnea, like go get it figured out, But even if you don't have sleep apnea, maybe you're having periods of hypopnea like I was, or, maybe there is something that you could use to support your airway while you sleep. Or, even like bright lights and that whole, with blue lights, trying to avoid those around bedtime, minimizing the amount of alcohol or like not drinking alcohol a few hours before bed, because that can affect the quality of your sleep. Caffeine is like a huge thing. For me, it was like, sure, I'll take a shot of espresso and go to sleep. It doesn't bother me. I can still sleep. But
you don't go into those deeper phases of your sleep.
Yeah. And so that's affecting your quality of sleep. And then, that's kind of like a negative feedback loop. So keeping caffeine in the morning, also not drinking too much even water or anything close to bed, that can affect the quality of your sleep. The light in your room. So
blackout
blinds, like that darkness helps with our melatonin secretion. So even though we can sleep, it doesn't mean that the quality of our sleep is great. So I learned all these things later on, and now I do all the things. So, I have a sleep routine, and there's things that I do to signal.
So what's your sleep routine? What does it look like?
So, I work with my blue light blocking glasses. So,
which is good, because I always say, I didn't even have blue light blocking glasses, because I just say I'm not going to work those 2 hours before bed.
Better.
No, but it's not possible. You know what life is like, right? There's always patient charts to be checked, and labs come in. There's emails to answer. So I should go get those glasses. Yeah. But yes, so have your blue light blocking glasses.
So I mean, it's a throughout the day type of thing. So like stopping caffeine, I don't really drink caffeine, but if I do, it'll be before noon. So that's, one thing. Once the sun goes down, I put my blue light blocking glasses on. And, I try not to have too late of a meal. Sometimes that's difficult as well, but, try to keep your meal, 3 hours before bed. And, and also, cutting off fluids and that sort of thing as well. And so then, okay, when I'm finally ready, I'm done working, I take off my glasses, I turn, I turn all of the lights in the house sort of dim. And I use night lights. So I have like night lights in my house. So I'll just like be walking around in the darkness
Okay.
when it's time, because I'm working like till the very end. So I'm trying to give myself at least like half an hour of, no blue lights. So I'll walk around kind of in the darkness with my night lights, with my blue light blocking glasses. Then I'll take a shower. So I'll take a hot shower, and that sort of helps to signal my body that it's time to go to sleep. Like when you have a baby, you have to follow a routine.
Yes.
So you take a bath.
Do you have a routine with Kason?
Yeah, I do.
Okay.
Yeah. So, yeah. But it's the same with
This
us.
is your own routine.
It's the same with us. Is like, we know how important it is. We want our babies to sleep. So we do like this routine, but then we want ourselves to sleep too. So we have to follow a routine. And it's just like, not to say that, you have to take a shower. It's just following a certain sequence of steps that is sort of signaling your body, okay, you're getting ready to go to bed. Yeah. So for me, it's, taking a shower, putting some lavender drops in there. And then that's pretty much it. Oh no, I put my nose cones in. Don't forget about the nose cones.
It's too funny. So our viewers can go onto your Instagram and have a look at your nose cones.
Yeah.
Please subscribe to my YouTube channel and send this to anyone that you know who will benefit from our conversation today. We really want to empower people, to help people to live their life to the fullest. Please subscribe. We would love to work with you if you're going through burnout. So you can look at my website, at Jessica's website. We will have our links in the description. If you're not in Ontario and you don't have access to us, I have an online course that you can work through on your own pace, where we really delve deeper and we look at what is burnout, the whole pathophysiology. How does it affect your body? Because we all need stress. Stress is good, but when does stress become harmful? When does your body say no? How to help heal yourself. And you're not doing it just for yourself. You're doing it for your family, for everyone around you. You're doing it for your future self, to not put you at risk of autoimmune diseases and cancer, cardiovascular disease. It is so important to invest in your health. So subscribe today to my YouTube channel. Join my online course today. Thank you so much for joining us. Thanks, Jessica.
Thank you so much for having me.
Thank you for joining us for Health and Wellness Talk with Dr. Daniela Steyn. Subscribe to our YouTube channel today. Connect with Dr. Steyn at www.danielasteyn.com. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay seeking it because of something you have heard on this talk show. Remember, you were created to thrive.